Hey, George, it's Tuesday afternoon, right before Thanksgiving 2025.
Yes, today we're going to do something a little bit different. We're not going to have a guest. It's just going to be you and I speaking, and we're going to talk about a very interesting topic what we're grateful for in pediatrics. Take it
You,
away.
re- you really think anybody will listen to this?
I don't know. They might. At least we'll tell them what we're grateful for and what we should be grateful for because we are physicians, and physicians should be happy and grateful for being a physician. Yeah.
Yeah, so I think the first thing is comment of the community is supported us.
Right.
And today we passed 50,000 downloads in the last 3 years.
I guess that's a lot. I don't understand these metrics and these markers and downloads and hits and whatever. It sounds like a lot. So if it's a
Well, we're
lot,
not
good.
we're not Joe Rogan. We're not getting $23 million a podcast.
No.
There's only 50,000 pediatricians.
So I guess
So
that's one pediatrician per download.
that's right. So every pediatrician is listening to us at least once.
Once. Our episode that we sent out today with Dr. Fry and Dr. Riley, I went to the office and some of the doctors were watching.
Really?
Yeah.
Wow. So they didn't know about it before.
No, no,
Wow.
that's good.
All right. So I'm going to be like David Letterman for those of you who are old enough to remember David. And my number one reason or thing I am grateful for in 2025 is George's and his beautiful wife Delia's friendship. It has
Okay.
brought tremendous joy to my life. And I want to thank you and Delia for that.
Oh, you're very much welcome there, my friend. And I guess with Zoom and all this technology, we're like these teenagers that we met online, right?
Yeah. Yeah. Online on a dare.
Yeah. Somebody dared us to do a podcast. We knew nothing about doing a podcast. And that was, I guess, pretty successful. We get some great guests and some interesting topics, some controversial topics sometimes. But people listen. Those once said, even bad publicity is good.
That is true. At least it wasn't around and spin the bottle in the basement. But I am
What
kidding.
else? Yeah.
I'm very grateful for all our friends on the Pediatric server list. I think it is an amazing group of people with very different backgrounds, very
Mhm.
different ideas, but we all come together because we love the practice of pediatrics and we love making children better.
Yeah.
And there is not a single day that list is boring.
Yeah, that's become more active than some other listeners that I'm on. Yeah, those guys, they become a little too much sometimes, but I just delete them.
Well,
Not that big of a
we,
deal. Sometimes when they get a little out of control with their views and their whatever, way past my
that,
interest level. Delete.
that's all right. It's a democracy.
Yep.
Everybody gets to say their opinion,
Yeah.
and then we all come together. And what really unites us, we are in this not to get filthy rich, but to take care of the next generation.
Yep. Yeah. Mentoring the next generation is very important because I've seen the next generation where I think they're being brainwashed in medical school to become a mindless robot and not think outside the box. Just do as I say. I think that's what they want.
They want people will follow Epic without thinking about the best interest of the patient
Yeah.
and who are afraid of standing up for what's right and what's
Yeah.
best for the patient.
Mhm.
That's what the big health systems and private equity wants. They want drones that will
Yeah.
just check the boxes so that the people on Wall Street or the administrators of these not-for-profit huge systems can take their $5 and $10 million salaries home. They don't
Correct.
care about that. They don't care about the patient.
Yeah.
Um,
I'm grateful that I'm still independent. I'm an independent pediatrician and I have a practice where we treat the patients well. We treat the staff well, from the secretaries to the physicians. They all have good jobs. They're all paid. I heard of stories. I won't say what organization it was, but I'm sure everybody knows in New Jersey where they shut down 90 practices and now it came out to Long Island. And it's really sad. Could you imagine the way they do it? You're going to work one day, somebody knocks on your door with a suit And just, can you step outside 1 second, doctor? We're going to be shutting down your office on this at the end of December, right before Christmas, and you will be without a job. We'll pay you until February, but you'll be without a job. They close down the secretaries. They fired they get rid of everybody. I mean, that's pretty darn stupid. If I was them, I would have just taken those doctors and redirected them somewhere else because doctors need a job. Who would have thought that a doctor would ever have a hard time keeping a job? What are your thoughts on that?
Well, I don't mind saying, healthcare is the evil empire. And they created Optum that employs more physicians than any other organization in the United States. And they were playing a game where they
Mhm.
pay their physicians a lot of money
Yeah.
so that they could circumvent the ACA rules that an insurance company cannot make more than 50% of the premiums. So they just pass it on to this other entity, and then they keep charging the middle class more and more money for premiums while their executives get filthy rich, not taking care of patients, not doing what's right for the patients, not improving healthcare, not improving outcomes. They're just
Mhm.
in it to make as much money as they can until they break the bank, and then they run to the Bahamas and live in their beautiful estates with their private jets. So this is what United Healthcare does, and they're not going to stop doing it. They've been doing it for ever since I've been in medicine, and they're very similar to what happened when the Clintons almost destroyed healthcare in the 1990s. Everybody thought that the HMO model and nurse practitioners were going to be it, and the hospitals downsized. They thought they were going to stop making money. Radiologists lost their jobs, and big hospital systems and small hospital systems bought all kinds of physicians only to beg them to leave 5 years later because they couldn't make money. So we're seeing a repeat of the stupidity from Wall Street and people like the Clintons all over again. Only that I don't know that we're resilient this time, and I don't know what's going to happen to the patients, let alone the physicians.
The patients are going to go elsewhere. Those
If
physicians,
again,
if they can find somebody. Like I was contacted by one of these organizations, these managed care organizations, which they Optum dropped for us to take on their patients. But I closed my panel in October because I don't need all these new patients coming in November and December and then get attached to our roster and then we can't get in the quality metrics and then fail at the end of the year. So I guess
mm,
come January 1st, we can let them in, but not now.
and why would you let them in? I think you have to be smart as a business owner. In pediatrics, the people that make money for a pediatric practice are the newborns in the first 5 years of life. For me to see a new patient who's 17 for a physical, that's a waste of my time.
Yeah.
It's just that for whatever, the $77 or the $120 I'm going to get, that's going to be one time. They're not going to come back. They're 17. They're going to go off to college. So why would I want them in my business? I want the newborns. I want the young kids that have lots of well-child exams, are going to stay with me for 15 or 18 years, and I'm going to build a relationship with them. So I have a relationship with them, and I'm going to make money. Taking a 15-year-old, 17-year-old, 18-year-old sports physical, let PM Pediatrics take care of that. I don't care. I don't want to see it. It's just not going to make money for me, and it's not going to be rewarding because it's not a relationship. It's total transaction, and I'm not in the business transactional medicine.
I know. Again, it's a little too heavy handed. We're grateful for the families that we serve and the new ones to come in. They're going to come in with a 10-year-old or a 12-year-old, 15-year-old. They're going to have another brother and sister in a couple of years. And then you get your newborns then. So you have to look at it not just as a transaction or only newborns and that's it. It has to spread across all domains, I think.
Yeah, I don't agree with you there.
I know. Yeah, I know you.
I think if you're starting a practice, you take anyone you can because you're desperate. But if you're a high quality practice and you're making money, then you start pruning and you make sure you have the best patients that you can do the best for. And the rest of them can find a qualified health center run by a big system, which is a shit show.
Oh, we know that. Now, why do you
So,
think it's a shit show?
because it's run by a bunch of people in suits who've never taken care of a patient, and it's a high need population. And there's never enough commitment from the clinicians because they look at it as a job, not as a vocation. And there's never enough resources to do what that high need underserved population needs. They need a lot of care coordination, psychologists, social workers, people that can arrange their Uber rides into the office because they don't have cars. And that takes a lot of people power, and
Right.
that's expensive. And in pediatrics, the margins are very thin. So
Yeah.
if you're going to provide all that support, there isn't going to be anything left over.
Yeah, but the hospital systems, they have the innovation piece, the EHRs, they have the call centers. They got what appears to be all the right things.
I don't think they have the passion for
Yeah.
the patient.
Yeah. And you know what? When we heard about it, and a lot of my doctors, when they heard about these closures, you know what the first question was from a doctor? What's going
Are
to
you
happen?
going to close?
What happened? What happens to the patients? Where they're going to go? They don't think about
Yeah,
that. They don't care.
of course not. It's a dollars and cents for them.
Yeah. They'll go to another practice down the road. I heard of one practice that they closed down here. A friend of mine, the father started the practice and then the son came over. He's older than us. But still, he was working and he was very late to the game with the innovation. They got an EHR maybe 2 years ago, finally. But he worked with them for a long time on paper. They left. His answer was, "They just leave me alone." So they probably paid him too much. They just left him alone. He wasn't really that productive. Many times he was closed, and they just merged him into one of the other practices. Very
Yeah.
sad.
Ve-
Sad.
Very similar experience here. A very good practice in my hometown. And the physician, she's a really good doctor. And she sold to a private equity practice that does urgent care, pediatrics, and family medicine. And within a short period, they couldn't figure out how to make money in her practice, so they closed it. And she had some, uh, I think it's some furniture that her father had built for her when she started the practice.
Yeah.
They
So
didn't bother. They
they got
didn't
rid of
bother. They didn't
got rid
bother to tell her we're going to close because they had a lease on her building, right? We're going to close. Is there anything in the building that you would like
uh,
to take before? No, they just all threw it in the trash.
yeah. They didn't think. They're stupid. You know, the other sad part about it, I heard it from my friends in New Jersey. You know, that guy, he would like to take over some of these doctors to help him get a job and so forth and so on. But these doctors have a restricted covenant, a very long mileage.
Yeah, I don't think that's enforceable. I talked to people in New Jersey too. They're not enforcing that because it's not enforceable.
Yeah.
But what the problem is that it's Optum is big business.
Yeah.
And so they're paying the pediatricians for 32 hours, 350 a year. And that's hard to do in pediatrics. If you have an all commercial great contracts and you can see 25 patients every day, maybe you can pay the clinicians 350 and still make a margin.
I don't think you're paying that much, Herb. But anyway,
No, that's what they're
I
paying.
understood they weren't seeing a lot of patients. They were low volume. You know, I spoke to somebody, he says, yeah, on a busy day we saw 18 and not so busy day we saw 10. I don't know. I guess that's the 1 hour visits.
I think it depends on your demographics, right?
Yeah.
So if you live in my neighborhood in Northern Virginia, where people are mostly white, more than college educated, it is the
Mhm.
wealthiest county in the country. No child adolescence less than 35, 40 minutes. It is
I don't
impossible.
I don't want
It's
to talk
impossible.
35 minutes, Dr.
I
Bravo.
understand. I understand. You don't want to, but it's a 35, 40-minute visit and the reimbursement is very good. So
Yeah.
these practices see 15, 16 child exams and 2 sick visits, but they're getting 200% of Medicare. They don't have to do the volume. If
Right.
you go to Dumfries near Quantico, where it's almost no one's white, everybody's on Medicaid, everybody's under resourced, and Virginia Medicaid pays $70 for a well child exam, whether it's an adolescent or a newborn, you got to see 4 of those an hour. And you get one adolescent with depression, eating disorder for their well child, and the whole train goes off the tracks.
Yeah, but that doesn't happen every day.
That's because you're not there every day, George. I can tell you it happens more often than it doesn't happen. And so that's a model that doesn't work. And that's why Medicaid doesn't work. That's why children shouldn't be on Medicaid. Children should be on the exchange and they should have the same right as a middle aged person employed by United Healthcare with a nice plan that pays an appropriate amount for a doctor to see them when they need when they need to see a doctor and access to subspecialists when they need access, not
Yeah.
a program that gives them half of what an adult gets and no mental health, no behavioral health, no endocrinologist, no infectious disease, no nephrologist because
I
they don't
agree.
pay.
Well, not a negative, Nancy.
No, it's a truth. That is a truth
No,
about what
that's,
Medicaid has done.
I know, Medicaid, but I think they're trying. I think with the Medicaid, it's the hospital systems that get all the incentives and the higher rates, and they just bang out specialists refer to specialists that refer to another. They're just like rolling the patients. Like I remember.
It is a communist. It is a communist like somebody that got elected in a big city in a state that's near you who promise everything for free and can't deliver. And so then they start taking away. That's why it doesn't work. You cannot trust these politicians. They promise everything to get elected, and then they just take it away from you when they get elected.
Yeah,
That's
they're a
what
bunch.
politicians do. They're a
They're
bunch
all,
of crooks.
all right.
And
Let's move
there's
on.
some,
Just this.
well, no, that's not boring. There's a bunch of crooks, especially in the big cities in the Northeast.
We know that they're a bunch of crooks. Anyway, what is it about innovation that you're grateful for this year?
Not even there yet. So the third thing is I'm so grateful to have had the opportunity, so humbled to have spoken at the 8th annual general population screening for type 1 diabetes at the Barbara Davis Center. I spoke in front of almost 700 physicians from 30 different countries. I stood on the shoulders of the giants who have done research for decades, like Dr. Simmons, Dr. Roars, Dr. Sims, Dr. Mike Harrod, and many others, Anastasia from Breakthrough T1D. And it really, it was phenomenal to be in the room with these people that have dedicated their lives to curing this disease and how far we've gotten, let alone to be asked to speak in front of them. It was an amazing experience. I learned a ton, but what an experience to be in a room of people that are so motivated and so dedicated to taking the monster out of so many families' lives.
You know what I
It's
don't understand?
amazing.
You know what I don't understand with this whole project of yours is how did
But
a general pediatrician like you become an expert in diabetes and not being a specialist in anything? I guess because you could learn and you can study. This is what physicians can do. They can learn about anything.
I
None,
agree, you can learn, but you
none of
also,
that I see in the younger doctors. I wasn't trained in that's why I won't do it. So you're the
that's
prime
what,
example for that.
that's what the journals are for.
I know, but I have to be trained in it to be able to do it. I don't know.
You read, you find mentors,
Yeah. That's why
and
we
then
have
you do it.
a license to practice medicine, whatever it may be. It used to be licensed for surgery too, but not anymore. I wouldn't do appendicitis.
Yeah, no. Or a hip replacement. I could see a YouTube video and maybe try it. I'm not sure it would end up well for the patient, but I could try it.
What about that number 29 resolution with the AP?
I think that was a tremendous joy. I'm no fan of the AAP. I don't think that they have good governance, and I don't think they have their eye on the ball. But when
Yeah.
it came to this, it was the only resolution that addressed clinical care for U.S. pediatricians and children.
Right.
And it passed with overwhelming support. Over two-thirds of the leadership at the meeting supported adopting or endorsing the ADA and ISPED guidelines to start screening everybody that has a first-degree relative on our way with a framework on our way to screening every child to prevent decay. And I think to me and the people involved, Lucy Mastriano from Buffalo, Peter Pogaskar from Rhode Island, Jesse Heckel from New York, incredible leaders in our colleagues, and the work they did to get this to the top of the agenda was amazing. I think it's a big one for children, and I cannot be happier or more grateful that this happened.
Now that's a really, really good thought. But was it one of the top resolutions that they had, or was it
It,
somewhere?
di- it didn't make the top 10, but as a result, the section of endocrinology is going to write a policy statement that moves the pediatricians to join where the science says we should be today.
I'm surprised it didn't make the top 10. Why didn't it make the top 10?
That's a vote. And as usual, there are many other social issues which are more important to the AP than the science of medicine.
Yeah, but a lot of people, this will never fly in a private office, in an office, because the first statement is going to be, what does the AAP say about it? If it doesn't say anything, then the doctors won't do it. I don't even understand why there's so much talk about this. It's a good thing to do. It's not that hard to do. Just do it. Why so
Too
many?
many, too many competing interests. You got to do this in between taking care of a depressed adolescent, between taking care of somebody with an STD, someone who's got congenital syphilis, somebody that needs their shot, somebody who doesn't want to take their MMR.
I guess.
So there's a lot of competing interests in the day of a pediatrician,
I
and
guess.
there's not enough focus on leadership of focusing on things that we can make a huge impact by picking fights that where we may not be able to make much of an impact. But they're dedicated to picking fights they lose, as opposed to trying to educate pediatricians and children and the children's parents on big wins.
I guess
So
I'm.
we could argue about giving booster shots to every child for COVID every year. There is not a single randomized controlled trial that's prospective that shows that does any good or any harm. There's just no study. And there's only, even if you use the flawed definitions from the CDC, 8,000 admissions a year in pediatrics for COVID and about 2,000 to the PICU. In diabetes, there's just in children, so in adults, there's 60,000 new cases a year. In children, there's 24,000. Half of them are in DKA. So there's 12,000 PICU admissions. And you could prevent 95% of those PICU admissions by drawing a finger stick in the office at 2 and 6 years of age. So compare the two. You could prevent 12,000 PICU admissions, or you could prevent 2,000 admissions. One has decades of evidence-based medicine to support the intervention and causes no harm. The other one has no evidence-based medicine. But yet, how much do you see on social media about the fights over COVID vaccines? It's
I'm
every
tired.
day,
I'm tired.
unending, unending. What, does it make a difference? No, it doesn't make a difference. It's purely political, lack of focus. We should focus on what interventions do the most good for the most people, period. Move on. Let the politicians tear their hairs out and fist fight. We're not in the business of politics.
So I guess you have some friends at the AP leadership. I wouldn't.
I think we're blessed. We have many friends in the P. They're wonderful people. They're wonderful pediatricians. They're dedicated to life, some to independent practices, some to academia, and they really care about the kids.
Yeah.
And they're
Most
amazing people.
most doctors care about the kids.
I think most society cares about the kid. Sometimes you're distracted by the shiny little object and don't pay attention to where you can do the most difference.
I guess. Now I understand you worked with Chip and Dan on some EHR
So
combinations. That's pretty cool.
yeah,
Get P and PCC to play together in the same sandbox.
so they're amazing. They're both great leaders within pediatrics, and they both have personal stories that have touched their families with T1D.
Right.
And so we are in the process of normalizing data so that we can create a data registry that involves about 20% of the kids in the US, including every single state, so that we can improve the care the pediatricians provide to T1D patients throughout the country. And the amazing work these two people are doing to get this, their organizations, and get this done is unbelievable. It is, I am incredibly grateful for their friendship and their commitment to making children's population health better. I'm hoping that by the time PMI rolls around in February, we will have some stuff to present to the group and work with Polly to bring this in front of 600 pediatricians that come to that meeting, really thought leaders, CEOs, managing partners of the best practices in the US.
Yeah, no, those fellas, Chip and Dr. Fighton, they're rainmakers. They can move things if they, especially Chip. If he wants to do something, he can make it happen. If he doesn't want to do anything, they're done. But it's good that two competing organizations were able to come together for the greater good. And that's really impressive. And I'm very happy to say that if you're going to get an EHR, the only one you should even look at is OP or PCC. That's it. Don't look at eClinicalWorks. Words. Don't look at Epic. If you want to be stressed, take Epic, take eClinicalWorks. But those two are very easy. And now I asked you a question before about the innovation. What are you grateful for about innovation? What are your thoughts on that? I love innovation.
You do. I like innovation, right? But I'm not where you are at with generative AI. I think it's still in its infancy. I don't know what it's going to look like when it's all done.
But you got to look
Um,
at it from the point of view of it is just another piece of the toolkit. It's just another stethoscope for you. If it gets really smart, if it starts making diagnoses, if it starts doing everything, I don't need you, Dr. Bravo. Nick,
I don't think it.
what's the
I
machines?
I don't think it'll ever do everything. But what it's doing now, it's a step below of just good enough.
It's good enough.
Um,
It's supposed
it's a
to,
step.
it's a better
It's just.
product that you never read. It's definitely better than the darn templates that were there before.
I would agree with that. I would agree with that. But you're going to make me go off another tangent of politics as to why the HR is just a piece of poop that
It is.
was thrusted upon us for no good reason other than to make the government happy and
Yeah.
make the administrators collect their pennies. There was no other reason for the HR. It doesn't serve any other purpose right now.
It is good in a way because you have better documentation, it's better billing. Back in the day, people used to bill out 99214, and the note was this big. There was nothing written in there but gibberish. No wonder the insurance companies didn't want to pay you 99214 and audited you. Now, if you bill a 99214, here's a note. You could put it into, what I've done? Sometimes now they're doing this down coding business. You can drop it into
Mhm.
one of these HIPAA secure chat GPTs. Don't do chat GPT because that's not HIPAA secure, but they have HIPAA secure versions of it. You can drop the note in there. You can ask it, can you analyze this note and tell me the level of care and why it is that? The darn thing will analyze it and give you the different steps of medical decision making or time. And it'll say, yes, this is a level 4, or no, it's not a level 4. And if it's a level 4 and they downgraded you, you can ask it, okay, now write me an appeal letter to challenge this automatic downgrading. And while you're at it, put in some legal citations, contractual language, some other legalese in there. And they'll pull out with there's some laws that they're not allowed to do this. And then you submit that appeal letter with your note. Have a nice day. They get overturned all the time.
Yeah, there is used to it. I don't think it is where it needs to be yet. I use it.
It's never going to be to your satisfaction.
I don't know that's true. I just sometimes it's very helpful. Sometimes it's just more frustrating. The hallucinations and the willingness of these large language models to tell you what you want to hear can be dangerous. Espe-
You need human intervention all the time. Otherwise, you have my rise of the machines. I always say, how many times do I say that? Rise of the machines.
yes, but it should not be that hard to summarize a newborn, not a NICU grad, a normal newborn history, for the machine, it should be so easy for them to summarize it without me having to read the 5 pages from the hospital list.
Oh, there is.
And I still can't get it. I
No,
guess I still can't get them to do it. They give me what they think I should expect. So like a 3,500 gram term baby vaginal delivery, and the kid was C-section, 10 pounds, mom's a diabetic, and it's right there on the paper, but it just wants to tell me what I want to hear. And
well,
that's a big problem.
I think that's your opinion because
I, I
I've
can show you. I can
I
show you.
know.
I can.
Let's stop talking. Listen, I've spoken with the students and I learned from the medical students. I learn every day from these medical students. I think I learn more from them than they do from me sometimes. You're supposed to give it what's called prompts or commands. And they're very important. You're supposed to say, if you type in, summarize this document, you're going to get what you think you want to hear. Summarize this document. Tell me about all the medical conditions that you find. Tell me the weight in pounds, because the parents want to know in pounds and in kilograms. Tell me the type of delivery. When would the vaccines give? You got to give it little prompts and it starts looking for it. But if you just say summarize this, it'll give you good enough, but it might have some hallucinations.
It's beyond hallucination. Hallucinations is when they make something up.
Yeah.
There's a term for it. The scientists have a term at the University of Maryland, but it tells you what it thinks you want to hear. So it thinks that as a pediatrician, I want to hear it's a term baby vaginal delivery, 3,500 grams. That vaccine was given, hearing test was passed, serology was normal. And then you go back on the note, and that's all not there. That's all made up because it's
I,
telling me
I,
what it thinks I want to hear.
I
Uh,
respectfully disagree.
I will
The
share with you. I will share with you so you
I
can
know
see.
proper prompts. It may have happened once. It may have happened once. But you know what? Whenever you get out of it, you have to review it. Okay? Because if you copy, cut, and paste like a numbskull, it's going to be now introduced into your medical record, and it's a legal thing that you wrote, right? So my process is I summarize it. I take the piece of paper, good old paper. I walk into the room and I read it. And then it gets read into my medical scribe AI technology, and that gets put into the medical record. And then this piece of paper gets thrown away. I've had some doctors that copy, cut, and paste right out of the thing. And that defeats the purpose.
And then sadly, I would tell you that that hallucination and that ability of the language model to predict what you want to hear and get it all wrong is probably better than the templates that are
Oh,
full of things that
that's
never got done, inaccurate, and nobody ever looks at it. Nobody
well,
ever goes back and looks at it.
you're making progress. But at least if you use the scribing technology, for example, and you have a conversation with it happened to me where the mother, I told her you should get a vaccine. And she says, oh, we never wanted a vaccine. The last time the doctor never said. And then I looked at the thing and they had a whole conversation about why they offered it and they should get it. And then the mother refused. I read her that statement and the conversation.
Yeah,
They
you have
use
to
it
agree.
proper. Most people think it's going to be like I don't want it to be perfect. Okay. You know, they're developing EHRs are trying to develop a model where the thing turns on and it automatically gets put into your notes. No, I think that's wrong. The copy, cut, and paste forces you to at least overview it and then drop it in. And then if it's a mistake, at least you tried. You're not going to blame it on the computer. Again, everything that you're talking about is more advanced and it's going to become rising machines. I cannot wait until doctors start getting sued and I'd be called in as an expert witness because the lawyers will do that. They're going to start suing people and there's going to be lots and lots of notes to go through. I'd love to be an expert witness on these medical notes because I can tell you which one is real, which one's medical scribed.
Yeah.
But you have to
Yeah.
give it proper prompts. You have to make proper prompts.
Yeah. Yeah.
Anyways, enough with this technology stuff. It's good. Technology's progress is better than the papers that we used to. You couldn't read anything. Nothing.
It's true.
Garbage.
It was No one can read my handwriting.
Yeah. It's a time saver between writing the prescriptions. I remember when they used to come in, we had a right hand prescription. How many times I'd have to write the kid's name and his date of birth? And then I need my albuterol, I want my pulmicort, and I want singular, and I want this and some vitamins. Stab me in the eye. Now you want that? Okay, boom, boom, refill done.
It was awful. Yeah, it was awful.
It was
In,
awful.
in some states, they allow you to put up to 3 medications in one prescription. But in Virginia, every prescription has to be separate.
Yeah. That's a short scripts thing. But now with our product, Office Practicum, you can actually put a bunch of prescriptions and send 5 prescriptions out at the same time. The only thing is you have to review each one. It'll pop you up and you have to move it to the right. That forces you to review it. So you don't have rising machines. And you can send out multiple prescriptions at a time.
No, I'm talking about paper in Virginia. When you write a purple prescription, like the case you said, like albuterol, pulmicort, singular,
Huh?
from multivitamins, Flonase, Astepro, each one of those is a prescription. And
Oh,
each
yeah.
time you have to, in Maryland, you can put 3. So you can put albuterol, pulmicort, and singular in one,
Uh-huh.
Astepro and Flonase on the second one.
On a piece of paper.
Yes.
Oh, that's crazy.
So it was just like, and I think in Illinois, it was the same way. It's just writing that name, the date that you're prescribing it, the date of birth, and then signing it. And it was 5 times over. That was painful.
Yeah. Yeah.
That was painful.
So it's enough with technology. Now, what else you have on your list there, Herb? Just
Well,
want to
I
chat.
think I'm very grateful for having been invited by Dr. Grufferts, a friend of ours,
Mhm.
to the DPC Pediatrics Las Vegas meeting. What an amazing group of people. What a freaking energy in that room. And they have a significant business model that I think may be the future and the only way to save the cost of health insurance in America. But the energy in that room was like no other energy that I've seen the whole year. It was an amazing group of people, and it was just lovely to be with them in Las Vegas.
Yeah, that's good.
Yeah. And then I had the distinct honor and pleasure of having dinner with Jesse Hackle in his favorite steakhouse in New York City, somewhere where he's been going there. He used to go there with his father and his father-in-law. Huge place, 3 floors.
All right.
Um,
Who paid the bill on this? You, Jesse?
no, Jesse didn't pay the bill. But it was amazing to see him. It was amazing to see him tell
Gotta
me,
get him. We got to get him back.
yeah, have him tell me about his stories in that building. So they used to smoke pipes in that building before it became illegal. So now you would keep your pipe, like some restaurants will keep your wine or your bourbon in a locker. So they used to keep the pipes for their patrons. And then they would come in, smoke their pipe, have a whiskey, and eat their favorite steak. And since they made it illegal, they took all their customers' pipes and they put them up on the ceiling. So all the ceilings are full of old pipes from all the customers over, I think they've been in business for 50 or 100 years. It was a really cool experience. Apart from the
Sounds,
fact that I really like Jesse, it was a really cool experience for dinner.
yeah. You know what I'm also grateful for? You
But
had You said something about you were grateful to meet some of my college medical school friends, Colleen from Rhode Island and Peter from Rhode Island. That's cool. These are old school people. I'm grateful for the medical students I have from NYIT, which I learn from every single day, something new. They are amazing people. They're amazing kids and they're so curious and they're so smart. Either they're really smart or I'm getting really stupid, one or the other.
really both.
Fire they have, the fire that they have to learn to be a doctor. I get all sorts of kids that come. They want to do this year, what the number one specialty that they want to go into this year is family
Yeah.
medicine. Go figure that one out. This year it's family medicine. There used to be radiology, interventional radiology. It used to be the specialty, the cardiology, the dermatology, the anesthesia. Last year was anesthesiology and dermatology. Now this year is family medicine. Go figure.
Well,
They come to our office, they hang out with us. If they learn anything, they learn how to be a physician, how to behave, how to speak to people, how to engage with people, how not to talk to the computer, to talk to the patient, which goes back to your physician-patient relationship. Again, something that's lost in the ivory towers and the private equity organizations. They're just punching. I love it when they walk in for the first day. They're quick to jump onto that computer and log in. I say, oh boy, don't even touch the computer. We got scribe technology. We just look to see what meds are on the problem list, and then we move on. And we talk to people. We engage with people. They love it. By the end of the month, I can get them working and seeing patients, and it'll take a really long time until you figure out that they're not full doctors yet. That's pretty amazing. I'm grateful for, I guess I have a little part in developing these guys, and they come back as a fourth year. But the best part is hanging out with these young people and mentoring them how to be a physician. I think I love the best. And I'm spreading that onto some of the other doctors in the organization, because a lot of them, they don't want to have anything to do with the students. I can't be bothered. And I think that's the mistake.
I think
Thoughts?
you're I think you're right.
Thoughts. Yeah. And the families that we serve, that's good. People love you. You know how I love it when you go to Costco and you see some kid and they see you and you see in the corner of the eye that they know you. And I got a great one. My band, last week we played at a talent show here in Comac, right? So I'm with my band backstage. There was a bunch of kids also that were playing. And then there was this bunch of kids that were like 10 or 11 years old. And I look at the kid. I usually recognize the parents, but this kid had significant hair. And I said, hey, I know you. Aren't you the kid that snowboards and your parents are instructors at Windham Mountain? Because every time they come in to talk, we talk about Windham because I go skiing there. And it says, yeah. And the kid goes, and I know you too. You're my pediatrician. And then there was a fundraiser for the Kiwanis Club or something like that. And they were raising some money for some kid that had multiple sclerosis to send him off to Epcot Center. And they said, it's amazing how one of the people that were playing in one of these bands, we talked to the child and the child says, I was on stage with my doctor. Now tell me that's not fun.
That is amazing.
That is an amazing true story. Didn't even make
It
that
is.
the true story.
That is amazing.
Yeah.
And that is part of the joy of being a pediatrician.
Yeah.
That definitely is. I think I'm going to touch a little bit about how grateful I am for the friendship from Colleen and his wife and his daughters and all of your peeps from medical school, and
Yeah.
how much fun it was to be in Rhode Island with your wife and you and them, and get to see Peter Bogosker while I was there and enjoy a drink at his favorite bar. That was a really epic trip for me this summer. Really grateful for that opportunity.
That's very nice.
Yeah. And finally, I'm grateful for your father and my mother who have passed this year. Wonderful people that raised two humble men who care for children and their families and make good friends and many great memories that will live on with our grandchildren. I'm glad they're in a better place. I'm glad they're resting. But I am grateful for the gifts they give you and me for many years.
Yeah.
And with that, I'd
It's
like
close.
to tell the audience we're very grateful for you tuning in every week, listening to us. We love you. And we hope you have a phenomenal Thanksgiving with your families. Make memories. Keep the fight on. Don't forget the kids. Thank you.
Thank you.
Till next Tuesday.